Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Thematic Apperception test assesses an individual's patterns of thought, attitudes, observational capacity, and emotional responses. It primarily evaluates underlying motives, concerns, and the way the person views the social world. The test is used to identify personality dynamics, including areas related to defense mechanisms and interpersonal relationships. It aids in diagnosing major conditions such as mood disorders, anxiety disorders, and personality disorders. The main purpose of the test is to provide insight into the respondent's unconscious drives and conflicts through narrative responses to ambiguous images. This facilitates a deeper understanding of psychological functioning for clinical or forensic evaluation. The Thematic Apperception test is indicated primarily for adult patients and adolescents experiencing psychological distress or personality disorders. It is most useful in clinical contexts involving assessment of underlying motives, concerns, and interpersonal dynamics that are not readily accessible through direct questioning. The test assists in evaluating patients with affective disorders, anxiety, and trauma-related conditions by providing insight into unconscious conflicts and emotional functioning. It is also valuable in forensic evaluations and psychotherapy settings to guide treatment planning and monitor progress. Empirical studies support its use for exploring complex personality structures and detecting implicit needs or conflicts. The Thematic Apperception test consists of 31 cards, each containing ambiguous black and white pictures depicting various social situations. The administrator presents one card at a time to the patient and requests them to create a story based on the image. The story should include a description of what is happening, the thoughts and feelings of the characters, and the outcome of the situation. Responses are recorded verbatim and later analyzed. Scoring focuses on identifying recurrent themes such as needs, motives, conflicts, and interpersonal dynamics. Clinicians evaluate content for indicators of underlying psychological states, including aggression, anxiety, and desire for achievement or affiliation. There are no standardized numerical reference ranges. Interpretation relies on qualitative analysis compared with normative data obtained through clinical experience and research. Consistency and prominence of themes across multiple stories inform clinical impressions regarding personality structure and emotional functioning. Response format is narrative, allowing for open-ended elaboration rather than fixed choice answers. The sensitivity of the Thematic Apperception test in detecting psychological disorders varies widely across studies, ranging from approximately 25% to 75%. Sensitivity refers to the test's ability to correctly identify individuals who have a particular psychological condition. Specificity, which measures the test's ability to correctly identify individuals who do not have the condition, similarly shows variability, typically between 50% and 85% in clinical research. For example, a sensitivity of 0.6 means that 60% of patients with a given disorder are correctly identified by the Thematic Apperception test, while a specificity of 0.7 indicates that 70% of healthy individuals are accurately classified as not having the disorder. These metrics suggest that the Thematic Apperception test has moderate effectiveness and should be used in conjunction with other diagnostic tools to improve clinical decision-making. The Thematic Apperception test was developed in the 1930s by Henry A. Murray and Christiana D. Morgan at the Harvard Psychological Clinic as a projective technique designed to reveal underlying motives, concerns, and the way individuals perceive social situations. Early validation efforts focused on establishing the test's ability to provoke storytelling that reflected internal drives and personality characteristics. Over subsequent decades, research has examined the reliability and validity of thematic apperception test scoring systems, such as the defense mechanism scoring system and the social cognition and object relations scale. Studies by Smith and colleagues demonstrated moderate inter-rater reliability, with coefficient values often exceeding 0.7, indicating acceptable consistency among trained examiners. Efforts to establish construct validity have involved correlating thematic apperception test results with established measures of personality and psychopathology, yielding mixed but sometimes significant associations. Meta-analyses conducted by Weiner and colleagues reviewed multiple studies and found that while the test shows utility in highlighting thematic concerns and motivational patterns, its psychometric properties vary depending on the scoring method employed and the clinical population assessed. Additionally, neuroimaging studies have linked responses in the test to activation in brain regions involved in emotion and social cognition, providing some biological grounding for its interpretive framework. Despite ongoing debates about its empirical rigor, the thematic apperception test retains a body of scientific evidence supporting its application as a projective tool in personality assessment, particularly when used in conjunction with other evaluative methods. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.